A brief discussion about twin-to-twin transfusion syndrome. 20% of twin pregnancies are monochorionic, and within those monochorionic pregnancies, about 10 to 20% of them will develop twin-to-twin transfusion syndrome. What are some of the sonographic criteria of twin-to-twin transfusion syndrome? First of all, a monochorionic pregnancy, and that can be either monoamniotic or diamniotic. A fluid discrepancy greater than 8 centimeters is considered poly, and less than 2 centimeters is oligohydramnios. A cord size discrepancy, cardiac dysfunction in the donor twin, or abnormal Dopplers to include either the umbilical artery or the ductus venosus, and significant growth discrepancy of greater than 20% between the twins. Our office sends patients with twin-to-twin transfusion syndrome to Cincinnati for evaluation and for potential treatment of twin-to-twin transfusion syndrome, and Cincinnati uses a modification of the Quintero staging system. This involves 5 stages, the first of which is an amniotic fluid discordance where there is fluid still visible in the donor's bladder. Stage 2 is an amniotic fluid discordance where there is no fluid visible in the donor's bladder. And stage 3, where there is polyhydramnios in one baby with oligo in the other and critically abnormal Dopplers. It doesn't matter about the fluid in the donor's bladder at this stage. What exactly defines a critically abnormal Doppler? Well, at least one of the following are present: absent or reverse diastolic flow in the umbilical artery, reverse flow in the ductus venosus, or pulsatile flow in the umbilical vein. Where the modification comes in Cincinnati is that they add an echo exam to look for cardiomyopathy in the recipient. Echocardiography is thought to help determine the severity of each stage of twin-to-twin. Stage 4 is presence of ascites or hydrops in either baby, and stage 5 is demise of either baby. One of our physicians here uses a handy way to remember these 5 stages and relates it to fluid. So stage 1 is a fluid discordance with fluid visible in the donor's bladder. Stage 2, the fluid is that there is no fluid visible within the donor's bladder. Stage 3, the fluid is the blood flow through the Dopplers of some sort. Stage 4 is fluid within the baby's body, meaning the hydrops or the ascites, and stage 5 fluid being that there is no blood flow through the baby's heart. And this is I think a pretty handy way to remember the 5 stages. So what exactly is twin-to-twin? We know how to look for it and what some of the signs are in ultrasound, but what causes it? Well, twin-to-twin transfusion syndrome is the result of vascular connections between the monochorionic twins within the placenta. The majority of monochorionic twins have vascular connections, but only a very small percentage, 4 to 17%, ever develop twin-to-twin transfusion syndrome. When twin-to-twin syndrome is present, what are some of the treatment options for the patients? Well, there are 4. The first one is an amnioreduction, in which the blood flow through the placenta is improved due to decreased pressure of the amniotic fluid. And survival with this method alone can range anywhere from 37 to 83%. Second option is microseptostomy, which is thought to restore the dynamics between the amniotic fluid in both babies by poking a hole through the separating membrane and allowing the fluid to naturally even out. The third option is laser photocoagulation. This is go in and find the areas of connection within the placenta, and they laser that area and hopefully stop the shunting of the blood from the donor to the recipient. And then as a last resort, there is cord coagulation, where cord occlusion and sacrifice of one twin is thought to stop the twin-to-twin transfusion syndrome and prolong the pregnancy and maximize the outcome for one of the babies. And Cincinnati uses what they refer to as sequential treatment, where they tailor the treatment and the processes to each given set of twins based on what they see at each evaluation. And the thought is, with this type of approach, only the cases in which less invasive approaches have failed are they offered the more invasive treatments.
Created using Powtoon.